Hello, good morning. How are you?
I'm good. How are you?
Good. My name is Ying. I'm the student nurse level 1. Can I follow you today?
Sure. We're about to give medication to Shanae O'Connor.
Can you please give me the SBA?
Sure. This is Shanae O'Connor. She's a 34-year-old female in room 231. She's a patient of Dr. Engelbert. Her admission was due to a fever of unknown origin. She has an allergy to trimethoprim, sulfamethoxazole. She's a full code. She's allowed activity as tolerated. Reports the ED with fever, chills, and malaise, elevated blood glucose levels, decreased appetite, minimal urine output, history of diabetes for 26 years, end-stage renal failure. She has a history of end-stage renal failure, secondary to diabetic neuropathy, and hypertensive nephrosclerosis. She had a graft infection 3 months ago, resolved with IV antibiotics. She has a history of recurrent UTIs. She's alert and oriented ×3. Significant findings include an IV in her right forearm, AV graft at her left forearm. So she's not allowed IVs or blood pressures in that extremity. Denies tenderness, drainage, or color change. Recent weight gain of 10 pounds over 2 weeks. Reports dark concentrated urine of low frequency. Denies pain, burning, or difficulty with urination. Reports numbness and tingling to lower extremities and reports decreased sensation. She's tachycardic, has 1+ pitting edema, lower extremities with 1+ pedal pulses. No further complaints to head, neck, back, torso, extremities ×4. She has a temp orally at 100.9 degrees Fahrenheit, blood pressure 138/78, heart rate 108, respirations 20, O2 sat 97% on room air, blood glucose level at 210 milligrams per deciliter. I was taken at 5:45 this morning. She's on a renal diet with oral fluid restrictions at 1,500 milliliters per day. Urinalysis has resulted showing an elevated white blood cell count. We're closely monitoring eyes and nose and vital signs. Notify the physician of a temp greater than 101 or a blood pressure greater than 180/100. We're going to titrate the O2 to maintain SpO2 above 92%. We're checking daily weights. Her capillary blood glucose check is being performed before every meal and at bedtime. For now, we'll be giving her an antibiotic, and the rest of her medications are available in the MAR, which are not due at this time. Her CBC, CMP, and urine culture are in the lab, and we are waiting on the results. Do you have any questions?
Yes. Why specifically this client receiving this medication?
She has an elevated white blood cell count in her urine and will be started on a broad-spectrum antibiotic pending further lab results to inhibit progressive complications with the infection and possible sepsis.
And what action does the medication have on the body?
Imipenem inhibits bacterial cell wall synthesis by binding to penicillin-binding proteins. Cilistatin prevents renal metabolism of imipenem.
Okay. When should you question this administering this medication?
The medication is contraindicated only in hypersensitivity, and you want to. It can also have a cross sensitivity with other penicillins and cephalosporins, and you want to use it cautiously in seizure patients, patients with renal impairment, and geriatric patients.
Okay. Does the medication have a therapeutic serum level?
No.
Okay. Which vital sign must be monitored?
Lab results and everything. Pretty much we're still that really is what we're looking for. That's why we went with this particular.
We'll monitor eyes and nose, assess for anaphylaxis. The medication can increase the heart rate and decrease blood pressure, so we'll need to monitor accordingly.
Direct functioning.
Okay. What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
No.
But we need to pay attention to report any adverse effects. That would include anaphylaxis, and the medication won't be taken at home. So.
And what interventions must be taught for taking medication safely at home?
It won't be taken at home, so.
Okay. What are the side effects and potential adverse reactions?
The client could begin to have seizures, dizziness, hypotension. They can develop C. diff.
No, I mean.
diarrhea, nausea, vomiting, rash, pruritus, sweating, urticaria,
Some other things, but
phlebitis,
the actual
and of course anaphylaxis.
I looked up did not affect my decision.
Okay,
I was able to see
how will you know the medication is effective?
with her.
When the signs and symptoms of infection subside.
Thank you so much.
You're welcome. And we're going to pull the medication from the Pyxis.
Okay.
It's usually given IM, so it was surprising to see that he was going to do it this way. But
We're going to check the pharmacy for compatibility, just to check if the medication is capable of being mixed with
the order tabs.
imipenem.
Thanks for being with me today.
We're going to confirm the order for the MAR. That's it.
Okay.
Did I miss anything? Anything first, Rick?
I was scared that it's gonna run out. That should be 5 drops, right? I don't want to fill it again.
Miss Shanae,
Hello, how are you?
I'm good. How are you? Are you feeling okay today?
So.
Keep it up there. Keep it up there.
Can you tell me your name and birthday? Can I see your ID band?
Yes, O'Connell, 34 years old.
Do you have any allergies to
Yes,
medication?
I do. You want me to tell you?
Yes, please.
Okay, I'm trying my best. Trimterpene sulfate metronidazole. Is that right?
That is correct.
Okay.
Do you have any other allergies?
I think that's it.
Okay. We're going to check the MAR, confirm time. We have the
Okay.
right patient. We're going to check the dose, the route. We're going to give it IV piggyback. And check for the correct medication. I have the right medication.
Okay.
And Shanae, you're allowed to refuse this medication at any time.
Yeah.
Do you understand why you're taking this medication?
I think I have infection, right?
Yes, you have
I'm not feeling good.
you have an elevated white blood cell count in your urine,
Okay.
and we don't have the completed culture quite yet, so we don't know exactly what the bacteria is, but we're going to start you on a broad spectrum antibiotic that will more than likely be able to eliminate the infection.
Okay.
And when we get the cultures back, we'll be able to adjust your treatment accordingly.
Okay, sounds good.
So we're going to check your IV first. We're going to assess the site.
Okay.
Do you have any pain with the IV?
No, no pain.
Okay. We're going to flush it to confirm patency.
All right.
All right. No signs and symptoms of infiltration.
You're right. You gotta sign them. You can sign me out. I'll just sign back in.
Scan your ID band, please.
Yes.
Did you mark off my label? Like you're near the end of something bad. I just would. As long as you. Yeah, it's going.
Shut my clamp, prime my tubing.
Well, everything's fixed now, so.
Also, get the machine. Nice, 'cause I got that part.
Yeah.
Don't, and your head's not in the picture, there's like a spin back. Some last video, I had my hand like this, and this was, yeah. So it was like, and there went my hand. But all of a sudden, you're missing a hand. I don't know if you're able to keep you from.
This thing is not like charging.
How much is left in it still?
38%.
Yeah, because I went from 70 to.
Why is it not charging? I mean, it says it is. It says it's charging.
Is it white or is it purple? It's when it puts the X up there that it's not.
Yeah, it's got that X on it.
Yeah, it's not charging. There. Right there. You just can't pull it any further.
Channel select, guardrail, normal saline, yes.
Yeah.
What thing do you want me to talk about?
Rate,
We just go right over. That's fine. One question I just have.
30 milliliters an hour. Volume to be infused is 1,000 milliliters.
Hello, Andrea. My name's Steph. I'm a nursing 1 student. I've been assigned to you today. Can you tell me about your patient?
Sure. So we're gonna be taking care of Shanae O'Connor. She's a 34-year-old female. She's in room 231. She's full code. Her attending is Dr. Engelbert. She does have an allergy to trimethoprim sulfamethasone, and she's on a renal disease diet. She came in with a fever this morning from the emergency room. It is of an unknown origin. And she also has end-stage renal disease, secondary to her type 1 diabetes. She hasn't been able to control her glucose recently. Her last glucose reading was 155, so she does take rapid-acting glucose or insulin during the day, and then Glargine at bedtime. She's also complaining of chills, fatigue. She has poor appetite, and then she has a decreased urine output. And she is undergoing hemodialysis 3 times a week. She'll also be getting that this afternoon after her medication. She has an AV graft in her left forearm. That's intact, no issues, and then she's also waiting for a transplant. She's complaining of pain of the floor, just an achy pain after her dialysis, and she's receiving Tylenol at 650 milligrams every 4 hours as needed for that, and also for her her last vitals are 101.1 temperature, 95 heart rate, 96% O2 sat, room air, 138/78 blood pressure, and breath oxygen is 20. So we're monitoring those every 4 hours.
This is what happens when you use the
We're
same
also going to be monitoring
stuff
her
over
INO
and over
condition.
again. We have air in the line.
He's in her right forearm. The doctor ordered a urinalysis for urine culture stat, a CBC, comprehensive metabolic panel, and her last urinalysis did show an increase in white blood cells, so we do think she has an infection going on. She has a history of UTIs, so we're not quite sure what it is, so we'll be giving her a broad spectrum antibiotic just to cover that until we get the culture back. So we're going to be giving her Primaxin, 500 milligrams over 1 hour for that. Let's see, her lobes are clear, heart sounds are regular, S1 and S2. She does have tachycardia, no murmurs, +1 edema in her lower extremities. And then she also has diminished sensation in her lower legs.
That issue is hopefully
She has
fixed.
bowel sounds in all 4 quadrants, no pain or tenderness. Again, she has all
Doesn't
that
appear to be any
diet,
air in the
so
line.
She does have a decreased appetite, so we're going to be giving her a little teaching on that diet. She has an oral fluid restriction of 1,500 milliliters a day, and she did tell us that she had a recent weight gain
Go ahead
of
and
10
check
pounds in just a few weeks.
for clarity, expiration
Her
date,
urine has
and
been cloudy and amber, and she does have that increase in white blood cells in her last urinalysis.
I'm gonna scan my stuff here.
And she has a history of UTIs, so she may have another one. She reports decreased frequency in urination and volume, but she does have no pain or burning